Okay, everyone, thank you very much for joining us today on this very special webinar on providing safety and supporting mental health in the age of hybrid working. My name is Zoe Sinclair and I am one of the co-founders of This Can Happen. I'm absolutely delighted to welcome you all to this special webinar where we're partnering with Peoplesafe today to talk about a really important subject that perhaps we don't often talk about. So before I dive straight in and introduce everyone, just a few logistics. We will be having a little bit of a presentation and an open panel discussion between us all. Many of you have sent in questions and comments ahead of the session in the registration, but if you have any questions that you want to ask during the session, please do so. If you're on GoToWebinar, you'll see the control panel to the right-hand side of your screen. In that panel, there's a drop-down question box. Feel free to send in any questions. They're totally anonymous and they come directly through to me. So I won't call out any names. I will just read out the questions and go to various panelists to ask them. If you're watching the live streaming on YouTube, please do put your questions in and I will also be checking those questions as well. So without further ado, this session today, I think physical safety and feelings of security are intrinsically linked to our mental well-being, especially now that so many workplaces have gone to some kind of hybrid working. But what responsibilities do businesses have, to employees and colleagues have to each other, and how can we make a really meaningful difference? So in this session, we are going to highlight some specific concerns that employees have, that you have sent in, and we're really going to talk about physical safety and understanding how this impacts our mental health. So I've got great panelists here today. Firstly, obviously, Peoplesafe, who we are partnering with today. I'd love to introduce you to Naz Dossa, who's the CEO of Peoplesafe. Naz, welcome.
Thank you.
I'd also like to introduce you to Daniel Fryer, who is a psychotherapist in private practice based in Bristol. And Heather Beach, welcome to you, Heather, as well. Heather is the founder of the Healthy Work Company. So welcome to all of you. And I think, first of all, Naz, really, I'd love to kind of turn to you, first of all, because Peoplesafe has recently done this report all about physical safety. And I think as a great start to this session, it would be great to understand those findings and that can really create the basis for this webinar.
Excellent, thank you. Great introduction, Zoe. And I've got some stats and some slides to run through. So I think the first thing that you touched on is that the world of work has changed forever, and the whole premise of going to a fixed location at a fixed time on a fixed day has changed. And during the pandemic and post that, when people were returning to work, we undertook this study and we surveyed 2,000 employees and over 1,000 businesses. So we got a really good sample size, and I'm just going to share with you some of the things that we found. And I think one of the biggest takeaways from the report was that a large number of people think about their safety every week. And if you extrapolate out what we got from our study, you know, that's 6.8 million of the working population. And we know that that's not something that's limited to the workplace. So we're not talking about something happening at your place of work, because that's changed. And this is often employees or people concerned when they're commuting to work. And that can be during unsociable hours. And some of these stats are quite frightening. So when I say this, it's that 58% of people said they've experienced a negative event that made them feel unsafe at work or on their commute to work. So that's a significant number. And if we could just head to the next slide, please. So if I can just sort of take this down a little bit further in terms of some granular detail, some of the stats you see on the top right of that chart are around the sectors, and some of these are obvious. So hospitality and retail, these are frontline workers, and they're facing the public on a daily basis. But it's also about certain workers who perhaps are going in between jobs or traveling and commuting or have varied locations, and that's where you think about healthcare there and some of the incidents that they're seeing. And then there's the bits that you don't think about perhaps or don't see, and that's not having a safe space at home. So there's been a number of stats talking about, or studies that show that there's been an increase in domestic violence. And what does that actually mean? Because whilst you're at home and there's no statutory obligation for your employer, you are still working. And I think it goes beyond that, we don't have to do anything because we're not told to. It's about how we feel about employees and what we feel we should be doing. So we'll go a little bit further with the next slide, if I may. So as we said, a lot about feeling unsafe is outside of the workplace, and 60% were using public transport at unsociable times or off-peak times. 50% of those were traveling alone to and from work or working in unfamiliar locations. And there's one case study from our report in particular that I really wanted to highlight, and it's about a care worker. And she had such concerns with the role that she was performing and the dangers that she was potentially in, that she would only stand at the exit to an apartment, a building, a residence, and she would park her car in a particular place facing outwards in case she had to make a quick getaway. Now, if you just pause and think about that, and you're just doing your job, and actually it's a care worker, so it's a role that should really be applauded. But that's kind of some of the incidents that were being relayed to us and what people were experiencing, unfortunately, on a day-to-day basis. And if we just kind of move on to the next, and this is where we talk about the relationship between the employer and the employee, and there is clearly a disconnect. There's a huge gap. In fact, we could go that far to say 57% of employers underestimate the level of personal safety concerns of their employees. So they just don't know, or they don't consider, and they're thinking, well, you just turned up to work, we're not sure if anything happened. Actually, there is a consequence as well of some of what happened, and it can impact and affect your work. And actually, I'll go on to talk about that a little bit. Now, most employers openly admitted they don't know what they should do to protect their staff, and that's kind of fine or not fine, but they were just being honest. And then staff actually said they do have a good idea, with 2 in 3 saying that they don't have access to any measures whatsoever. So they don't know what's available, and they don't know perhaps how to even raise their hand and say, look, I'm kind of, my shift finishes at 10 o'clock at night every night. Clocks have just gone, it's darker, what can I do? How could you help me? So as a result, unfortunately, nothing's being done. And that has led to employees, and this really came out in the survey, saying that they just felt a bit let down because they didn't know how to raise the voice and they didn't know what help was available to them. So if we could go to the next slide. So this is about impact, and sorry, I think it's just one up if you don't mind. That's it, perfect, thank you. I think I went too quick there, so my apologies. So look, I'm responsible for running a business, and I am certainly feeling the pressures of talent retention and talent attraction at the moment. And often it's about not knowing the real reasons why. And so we've all heard about the Great Resignation. We've all heard that there is an impact to the macro environment at the moment. And what we found from the study that we conducted was that 1 in 4 people left a job due to a safety concern in the last 5 years. That's 25% of the workforce. And this was particularly felt in public-facing roles such as hospitality and retail, as we've talked about. But 2/3 said they would not return to that sort of type of employment going back. So there is a problem building up here, and it's about how do we do something and think about the impact. So let's say there's an incident. There's an impact to the individual who's had the incident, right? It's about their well-being, their mental health, and how they deal with that and cope with that. And I think it's a call out to employers to say, we need to do more, we need to consider this and find a mechanism to allow employees to speak up in certain instances. And the next one, please. So, and I think paying more attention, because there is a cost to businesses as well, and this is generally a hidden cost, and it's kind of saying retention rates are impacted by this, and the cost of recruitment comes into play as well. But more importantly, it's about creating that sense of well-being for your employees. You know, you have a duty of care, you have a responsibility, and how can you make them feel safe for just perhaps coming in to do work at different times than they normally would do. And just my sort of final piece. It's a startling set of stats here that the changes in behaviour that individuals made, and that's 83% of them did something, and you can read the stats below. You know, you changed the route you took, you started travelling with a colleague, started alerting someone to your whereabouts. So perhaps, look, if I don't get home in the next 20 minutes, call me, or if I don't call you, raise an alarm, or whatever it may be, call my mum. That's really quite startling, as I said before. You know, people are changing the way they simply go to work to feel safer. So that's it from me.
Perfect. Fine. Did you want to speak about this, the apps?
Yeah, sure. So I was going to just, I'm conscious I've taken some time here. So this is, and some of this would have been covered in some of the questions we've got in, but there are ways to deal with this. There are a number of applications out there. Nearly everyone has a smartphone today. You can have access to applications that sit on your smartphone that provide sort of check-in, check-out, welfare checks, even well-being checks, that can provide you with that sort of added scope of safety that your employer is doing something, and you have the ability to raise an alarm or speak to someone in the instance that something unfortunate happens to you. And that's really the only point I wanted to make on that slide.
Okay, no, perfect. So I really think that that has just, you know, created the basis for this conversation. So I'm very grateful to you for that. So one question I want to ask you before I bring in Heather and Daniel, I know you mentioned a few times about sort of over the last 5 years or so, but do you think this has really been exacerbated, this feeling of not being safe, by this new concept of hybrid working? Or is it just that the world around us feels more unsafe than it has ever been?
It's a great question. I think it's always been there, but it's definitely been exacerbated. And we know there is an increase in aggression, especially in sort of the retail sector or the hospitality sector. And there is a rise in reported incidents on public transport. And therefore, that means more people are experiencing these and are definitely feeling more nervous as a result. And perhaps, you know, the whole returning to work or having to travel, even for a period of time, makes people feel more anxious anyway. And this is causing a bit more of an issue around this.
Yeah, and Heather, would you like to comment on that point, actually, bearing in mind, you know, the work that you do with health and safety as well?
I think what Naz has been talking about is absolutely fascinating. I myself wasn't aware of some of those stats, but it actually really stands to reason. And for me, one of the things which I perceive is that the whole concept of lone working was something which few organizations considered, and it was something which was considered if you were in a job which was clearly about lone working, and almost the terminology was quite an off-put for everybody. If you had people working from home, you didn't look at lone workers, you didn't consider yourself as having lone workers, for example. And now almost every organization should be considering this type of thing. And for me, it speaks to an increasing range of responsibilities and risks for the health and safety professional to consider. So well-being is a really interesting place to be right now, because health and safety originally were very keen to take it on, but what it looked like when they took it on was some mental health first aid, which is a tertiary intervention, really, when things go wrong. It didn't look like looking at the risks within your organization and tackling those risks from a psychosocial perspective. So some of the organizations that I'm working with right now are thinking about fatigue and how that impacts people's safety. They're thinking about bullying, harassment, violence at work. Are they thinking about lone working, as in almost everyone is a lone worker or almost everyone travels to and from work and feels more unsafe? I'm not sure that they are. So for me, that's what's really interesting about this conversation, is it just creates another layer of things which the health and safety professional should be considering in order to support well-being for their employees and also to support their personal safety.
So that's fascinating. And actually, I go to the audience, which hopefully we can come back to, but I go to the audience to say, audience, tell us, do you feel like you're a lone worker at the moment? Do you feel that your role has changed and you would never have considered yourself as a lone worker, but now you do? I'd be really interested to understand what the audience think, and hopefully we'll report back on that. So Daniel, just to come to you to ask you about, I suppose, this whole concept of how physical safety interacts with mental well-being. I guess it's not something that we've always thought of straight away. We sort of think of your mental health and physical health, but physical safety and mental health, interesting.
It's why I like the term well-being, because well-being includes everything: mental health, physical health, social health, financial health, all of it. And it all interacts. It's never separate. Everything is correlational and everything exists as a whole. And if one of them is out of balance, it can affect the others. Lone working will affect. That's just one aspect of safety at work. Think about your job. Are you given everything that you need in order to do your job safely, effectively? If you don't, that's stressful. If that's stressful, that will affect your mental health. Is there clear lines of communication in your office? Are you aware of your roles and responsibilities? Are there clear roles, responsibilities, policies, procedures? Everything needs to be in place. Clear communication, all of it, because if any of those factors at work aren't in place, that is an extra stress on what is already a stressful, demanding role, because everybody's role in everybody's sector, in anybody's industry, is stressful anyway, because stress is the #1 cause of staff absenteeism. It's become more stressful since COVID, as we constantly shift and adapt and readapt. And if any of these organizational factors aren't in place, it adds to that burden of stress, which very quickly becomes a tipping point to a mental health issue. But it also works the other way. If you have got a mental health issue and it's exacerbating and you're bringing that into the workplace, are you safe? You're definitely not as productive. Are you safe? Mistakes do get made. Well, depending on the industry, some of those mistakes, they will have very mild consequences. Some of those mistakes could have very severe consequences. So if you're increasing somebody's stress load and their mental health issues by not having all those psychosocial factors in place, you exacerbate a mental health issue. That person is not as safe and as productive as they could be, which exacerbates the system, the whole circle, and around we go. So they're not separate. I mean, for what I do for a living, they've never been separate. They've always been correlated, interrelated factors, all part of the same picture.
Can I interrupt for a sec, Zoe? Because for me, what Daniel just said there is critical, and it's been a missing factor in health and safety very much. In that they've seen the safety and well-being as being separate. So well-being is something nice that we do to make people feel better, and safety is the hard stuff. It's the looking at the hazards, it's designing out the risk and all of that. And actually, what Daniel is saying there is so critical for health and safety professionals to kind of get, is that that is what is missing in our, for me, that's what's missing in our approach to safety at the moment. If you think about the root cause of major disasters, a lot of them will have been underpinned by fatigue, or underpinned by, if you look at the airline industry, for example, anxiety, stress, those sorts of things. Are we starting to build into our approaches, asking questions of people before they start a task? Are you fit to do this? Are you well today? Or is you using that forklift truck going to actually result in a major accident for you or for other people? So I think it's fantastic what you just said, Daniel.
Thank you.
Fascinating, fascinating. And I just want to come to some of the comments, because people are writing in about the lone working and other things are coming out of it. So somebody has said, yes, now I work at home half my week. I do consider myself a lone worker. Our organisation is aware of people being in the office after hours and considers that as lone working, but the situation is no different to me being at home by myself at 2 p.m. in the afternoon, for example. So I think, you know, Naz, that's fascinating, and that's exactly pulls out, you know, from your research, that's exactly what it's saying.
Yeah, I could not agree more. It's kind of the forgotten cohort, if you like, that what happens if, look, if you're in an office and you fall over or something happens, an incident, there's people around you to help. If you're at 2 o'clock at home on your own, you've gone to make a cup of tea and you fall down the stairs, quite possible, right? What help are you going to get? How can you get help? Because you're at work at that point, and forget with a physical location around you, you're at work, right? So I think it's a very good point. And as I said to you, I don't think employers have quite woken up to that yet.
Yeah. Interesting. Okay, so it's slightly different point, but someone has said, a quick point, some weeks I look after my girlfriend's dog when I work from home alone, and I feel so much mentally better. Maybe because I have to go outside to walk him twice a day, but it feels like at least I have company when he's around. Again, getting away sort of from the lone working side of things. I just wanted to read that, and there's, sorry, quite a few others coming through. So interestingly, somebody has said, office is the same for 50% of the time I'm at home, I am alone. The mental side of that, I probably worry about more than the physical side. So that's obviously everyone it thinks differently, but again, it shows you how intrinsically linked the mental health side is of being alone. And just one more comment, and then I want to go on to some more discussion. Or there's so many points coming on, so I will do my best to get to them. Somebody has just written in to say, actually, I'm going to read that one through because it's quite a long one before I come to you, but I come back to it. But Heather, I wanted to ask you. There's sort of, again, this look at the physical versus mental stance, the concept of psychological safety and where that fits in between as part of physical, as part of mental. What does that look like when we're working from home?
I think that it's a sort of, again, another missing piece, as it were, that organisations probably aren't addressing quite as well as they did during the pandemic itself. So during the pandemic, we had a huge effort, I would say, from organisations to make sure that they regularly checked in with people. They were doing, you know, coffee catch-ups, quizzes. I was on some really heartwarming webinars where CEOs would talk about, you know, how they were struggling at the time, and people really responded to that, because what psychological safety is about is, I feel safe to bring my whole self to work. I can tell you I'm vulnerable. I can tell you that I've noticed a hazard that I'm concerned about. And it's really an interesting area, because it's critical for safety. And I think we've considered it a little bit from a physical safety side in the past. So, you know, if we have a psychologically safe environment, we're far more likely to walk around, go to a supervisor and say, look, I'm not feeling safe about that item there, or this doesn't feel safe to operate today in this way. So it allows me to say what I think. It allows me to know there'll be no recourse if I you know, whistle blow, that sort of thing. But where we've looked at it less is where it comes in from an HR side as well, which is that actually the work that Google did on Project Aristotle showed that if you have a team which feels psychologically safe, i.e., I can come up with any madcap idea, I can say exactly what I'm thinking, I can ask silly questions, you'll have a team which is more connected, creative, and productive. So but what we're not doing necessarily is training managers in how to create that type of environment. And if we are training managers, we're not training senior leaders, because they tend to be left out of the training that we're doing. That's the way it occurs for me anyway. I'd be interested to see what other panelists think of that.
Yeah, so I think the manager piece is a really important piece there, because and I've sort of talked about this quite a lot, but managers have had an awful lot to deal with and an awful lot of change. And we can't just assume that suddenly every manager is going to, well, sort of, somebody said to me the other day, most managers have IQ and not EQ. And I thought that was really good. And it's very difficult for managers who were originally, I know, hired because for the role that they're supposed to do, and IQ, whatever, to suddenly have EQ. And how do we, is this too much for the managers to take on board, is what I'm trying to say.
And for me, it has to come from the top, and that's what we're missing. So if you've got senior leaders who are not only saying the right things, but actually walking the talk, and, you know, going home themselves if they're not feeling well, you know, not sending emails at 11 o'clock at night, showing that it isn't all about performance, it's also about people, that then gives managers permission, and it also gets them to actually understand that these are behaviors that perhaps they should be role modeling. At the moment, my team gets called in to train managers in exactly what you're talking about, Zoe, and we tend to find, you know, lots of them are very open to it, but there's always a sense that, well, it's all very well you're saying this, but, you know, really it's all about performance here. That's what we're judged on. So
Yeah.
really, that for me is the tougher nut to crack, is the senior team.
There's probably some irony. Sorry to jump in, and then sorry, Daniel. I'll be very quick. There's an irony in the statement, right? That they would probably get better performance if they manage the people in that way, so that they, rather than doing the whole sending emails at 11 o'clock at night and driving all the performance, rather than seeing how they're actually feeling.
Yeah, absolutely. Daniel.
Thank you. I agree with everything Heather said, and it is a top down as well as a bottom up. If you want a place that's physically safe, psychologically safe, that's for everybody, and that includes the people at the top. If the CEOs are not feeling safe, if they're under pressure, if they're not dealing with their stress very, very well, they're suffering the way everybody else is. But they're also creating an environment. If they're not talking about it, they're creating the environment from the top down where it's not safe to talk about it. That gets passed down to the managers from the people above them. That gets passed down from the managers to the people below them, and so on, from the very top to the very bottom. So creating that safe environment is for everybody. CEOs are notorious for not wanting to seek help for their mental health issues. They see it as a sign of weakness. They don't want their staff to think they're weak. Well, if you change the message and it's not, talking about this isn't a sign of weakness, it's a sign of strength. It's a sign that you have created that safe community. So it starts there. Managers will then learn that, and they will create these open dialogues. They will also create open policies with their HR staff, and it gets filtered down that way. And you're talking about EQ. Social intelligence is now considered to be a key leadership skill, a key management skill. Before, we wanted, who are good managers? The decision makers, the ruthless ones, the ones that just come in and got it all done. Well, the world has changed. That is not the top skill anymore. That is not how you create a happy, productive environment. And if you want to think in terms of money, think in terms of productivity. People who are happy, people who are safe, people who are secure in their role are more productive, are less prone to making mistakes, and stay much longer than people who don't. So they're saving you money in terms of recruitment, training, etc. So you want to be, if you can't recruit people with EQ or social intelligence, these skills can be taught in workshops. For some people, it's a natural learning curve. For other people, it's like a revelation to them. Sometimes it's like sticking a spanner in the well-oiled machine of their mind and watching everything explode as you teach them these social intelligence skills. But these skills can be taught, and they all help to create a safe environment.
Fascinating. And what I'm finding really interesting about this whole sort of, the physical, the safety and mental health is it's really bringing out a whole variety of questions and comments. So I want to go to them because I think it's really important for us to address them. But sort of, I'm not apologizing as such, but you'll see that we're going to jump around a lot because it's bringing out different things from different people. So bear with me on this one, but I think there's some really interesting points. So this I find absolutely fascinating, linked to fatigue that somebody mentioned originally. So somebody said, I'm definitely a lone worker. Due to autoimmune disease, I am remaining at home whilst others are hybrid working. I volunteer on the steering group of our fatigue network for staff. I didn't even know that that exists, and I am fairly up on networks in organisations. So they have a fatigue network for staff suffering fatigue due to a long-term condition. We have 500 members with about 100 different conditions causing fatigue. Many of our members had a positive experience of home working during COVID and are now fearful of the general population feeling it's all over. The risks are still very real for those with health problems. And I just wanted to thank that person for even telling us that that even existed. And, all credit to the company for supporting that. But that's, I don't know if anyone wants to say anything on that particular point, but I just thought that was fascinating. Right.
Yeah. I was going to say, I can say, there's a nice analogy. There's that expression, we're all in the same boat. No, we're not. We're all in the same storm. And we're still in the storm. We might be at the edge of it, but we're still in it. And some people are in luxury yachts and other people are in leaky little dinghies as we navigate that storm. And this, it raises the notion for well-being. Well-being is also about individuality. Well-being isn't a one-size-fits-all policy, nor is mental health. So in creating that safe environment as well, it's also about supporting the needs of the individual. So that's a very, very good example of doing that, supporting a group with that as a need, because you're absolutely right. Even though it's a lot safer for the rest of us, it isn't as safe for people who have autoimmune diseases. So well-being needs to always consider the individual. What applies here doesn't necessarily apply there. What it works for that person doesn't necessarily work for that person.
Yeah, and Naz, I'd be interested to know from somebody has said here, the amount of work that has been coming my way has exponentially increased and is becoming more and more stressful than before. So do we look at more and more work being, a physical safety as well? Can that be interpreted as a physical safety, or is that more from a workload is a mental thing? I don't know. I think it's both.
Yeah, it feels like the workload is a mental thing, doesn't it? And it's that case. So the approach to hybrid working has changed, because what I think employers have found is actually employees are working longer hours, because they'll just walk downstairs before they have a coffee or a cup of tea, and log on, and then actually way beyond before where they might be commuting and turning off from work, they'll just finish the email or continue that piece of work. And it's become this accepted norm that more work passes between the sort of manager and the employee. So I think that's a mental load. I was just going to come back quickly to the other point on managers, if I may, as well, is that there's a lot for them to take on, and they need to understand how to build resilience, because essentially they're going to be just sitting there, perhaps doing Daniel's job at times and taking on all these problems without having the tools to understand somehow how to deal with it, which I think Heather related to earlier. And it's also they only have a given set of time in the day to deal with all of this stuff, right? And even to the extent that where Heather, you were right, we spoke to a number of organizations during COVID, and they were doing these check-ins, and some remits were set with the manager that they had to call each member of their team every day just to say, how are you? Is everything okay? Which is a great initiative, but it's also, how do you continue to do that? And is it your responsibility as a manager if one of your employees is going between 2 client visits in a day and actually they don't turn up to the second one? Oops, what kind of alarm bell rings off then? So certainly lots to debate and consider.
Yes, yeah, absolutely, for sure. You just another comment. I just don't want to ignore the comments. There's so many comments that are coming through. I know we slightly digressed from all the questions that I was going to ask you, but I am going to come back to them. Somebody has said, with the increase in the cost of living, would the fatigue aspect for the member of staff be ignored by the employee purely on the basis that they can't afford not to be working?
I think that's 100%. I think we've got a massive issue ahead of us right now, in that there is no slack in the system anywhere. So, when I think back, my dad used to come home at 5 o'clock. He put his case down. That was it. He had the weekend off. He had his holidays off. And my mum was a housewife, so she was doing all the housey things and looking after the children whilst he went to work and came back again. Oh, those halcyon days. Now we're all working more than 9 to 5 jobs. We all finish the day thinking, I haven't nearly done everything I'm supposed to do today. And if you look at, I'm imagining that some of the people on this call are in health and safety, perhaps in HR. Those professions were under enormous pressure during the pandemic, and that pressure hasn't really abated. Even in well-being, I know 2 or 3 well-being people who are off with burnout because they were expected to pick up so much. And where I think this is going is that individuals are having to set their own boundaries much more strongly than they used to in the past. And it's really, really tough. If you're a people pleaser, a perfectionist, if you like to be seen to be doing a really good job, to say, sorry, these are my boundaries, is really, really, really tough. But if organizations are not setting them, then individuals are going to need to. Otherwise, there's going to be so much sickness through stress and the physical health issues that result from stress.
Absolutely. And just, Heather, I want to go back to what we were just talking about with regard to psychological safety, because somebody has asked, how can we increase opportunities to notice psychological safety or lack of in a hybrid world?
And for me, this is something that, again, when we do our training courses, we build in a section on how can you increase connection. Because when we had this, when we had the pandemic, as you said, Zoe and Naz, there were actually times that people were kind of tasked to check in regularly. And that, for me, seems to have gone by the wayside since we've gone back into the office, because we've got some roughly, I don't know whether your research backs this up, Naz, or whether you even looked at this, but the research that we did recently showed that around 50% of organisations were being really prescriptive over everyone has to be in on a Tuesday, Wednesday, Thursday. And in a sense, although that can be annoying, it does mean that there are times when everyone's going to be together and there are more opportunities for connection. Others who are being a bit more, as it were, generous about it and saying, come in when you feel like it, there actually isn't then that opportunity created for people to connect. And the things they used to do on a Friday, like go out for a drink to the pub or something, or take people out regularly, just aren't happening because people are trying to cram in those meetings. So again, it does, and it's difficult. Middle managers, it's really, really difficult, but it does come back to middle managers thinking about how they're going to make sure they create space for those one-to-ones, and how they're going to create that connection within their teams. And then it comes back to role modeling. If you're seeing people within your organization who are saying openly, I am struggling with, or I have struggled with, then you're far more likely to get that becoming part of your culture.
Yeah, and on that point, somebody has just written in to say, totally agree. I mean, we've made lots of points. I'm not sure exactly what they agree with, but they're definitely agreeing with something. Totally agree. I'm very unwell at the moment, which has not been diagnosed yet, but I'm still having to work because I can't afford not to with the cost of living and the fact that I live on my own. I'm also a line manager, so I'm having to deal with my team's issues too. It's a very, sorry, just scrolling down. It's very difficult, and I'm in a no-win situation right now. I find myself constantly having fatigue crashes no sooner I stop work and feel like I have no decent work-life balance. So this is totally mental, totally physical, completely, exactly what this session's about, how the physical and the mental combine. And that is a prime example coming from a line manager, with the cost of living coming up again and again. And somebody has also said, somebody has said, basically the idea about mandating, here we go. I'm concerned about the added cost to the employee to sustain employment whilst working from home, energy in particular, especially if you're contractually obliged to work from home full time. What does the panel think about the role of the employer here in providing at-home working financial allowances? And they then sent in another message just to on top of that to say, may I just add that this concern causes financial anxiety, which of course is mentally debilitating.
Yeah, I'll comment as running a business here. So look, it's a really tricky one, and there's no silver bullet answer here in that this is what all employers should do. I think if you can get an understanding of your workforce, and that's, taking it down to, are they Gen Zs, millennials, etc.? What sort of requirements have they got? Are they still living at home with their parents? Are they living at home? Do they have the ability to work from home? And that's about communication and asking the survey. Then whether the financial point that the person and the attendee makes is a very valid one, but it's very difficult to answer because it is down to the employer and their capability and ability to provide something for their employees that are mandated to work from home and therefore have their own costs as a result of that. I'm sure some employers would argue that you're saving on the cost of travel to work. So and then you get into a real minefield of it. But it's about trying to be caring as an employer, and it's ever more so apparent today because of what people are facing that I feel a responsibility to the people who work for us, and but that doesn't mean everyone can take the same sort of stance. Sorry, I've gone round about it, but I can't quite give the right answer there.
Yeah, no, and I have to say, I wish I could get to every question and comment, but so many people are just saying that the pressure at the moment and the stress levels are so high. Interestingly, despite all the work, I guess, that we're trying to do on mental well-being, somebody has just said, and Daniel, I come to you for this first, I feel that most employees feel that they are accountable for their own mental well-being and to get on with it. How do you best create a culture where employees are open and aware of employer accountability and support is available?
Clearly defined policies on that area, ones that emphasize clear, open dialogue as well. Letting people know, if you work in HR, let people know, let your staff know the door is always open. Mental health issues are an employer's responsibility as much as a physical issue is. Not enough employers know that, not enough employers take that seriously, but they are. And because of the pandemic, thankfully, everybody knows that more than they ever did. But if your work is causing you stress, or if there are stressors that are impacting upon your work, there needs to be an environment. And maybe it needs to be you that creates it. So maybe you have to be the one to knock on the door and go, I do need to talk about this. And as the door that you knock onto, that person does need to listen and take action.
And I would just say also in response to that, somebody else has just written in, and it might be an answer for that person to say, our organisation has a mental health allies programme where we have a number of employees available for colleagues to speak to over the phone or email within working hours. Mental health allies are trained to listen but not solve problems and can signpost to external places if needed. It's early days, but has so far been positively received, although I'm sure there will be mixed views about that. So that's a very honest answer, and something that person might be able to take on.
Zoe, can I just comment on that one, because
Of
that's
course.
a subject that's very dear to my heart. When we first started, that is what organisations were all doing. They were training people from within the organisation to be mental health first aiders or allies or champions, and I think that that is fantastic. And you really should train your managers before you do that, because your managers are the people who, as an employee, I should be going to, and they are the ones who are going to be able to look at reasonable adjustments with you to make sure that the work is appropriate, and they should be your first port of call. So yes, absolutely, allies first aiders are a really good thing, and they also help to signpost what internal resources you have available, and they're able to collect information on what types of issues people are struggling with and feed that back to the organization, perhaps in a less threatening way than going to your manager. But let's negate the importance of your manager. That's what I would say.
Yeah.
Add one
Daniel.
tiny thing to that. So I am a mental health England first aid trained first aider. I worked in a large organization where nearly everybody knew who their first aiders were, and there were a dozen of them. Everybody knew who to go to for first aid. Very few people knew who to turn to for mental health first aid. But there were only two. In the same organization, a dozen physical first aiders, only two mental health first aiders. Everybody had been educated. Everybody knew who the physical first aiders were. Nobody really knew who the mental health first aiders were. So managing to create them and have them, you have to let everybody know who they are, where they are, and that they're available for you whenever you need them.
And create a role description and support for them as well. Where do they check in with each other when they're struggling? So it's at first, I think when it first came out, it was a sort of just taken on by organizations as a useful thing to do. And now organizations that are working with us to build in a program like that are looking at all the implications. Like, do we allow people to sign up? Do we ask people to sign up for a year? What does the role look like? How do they check in after they've had a difficult conversation? All of those things are now being considered in organizations. How do we promote it? Do we collect data on conversations? So yes, again, as Daniel said, it's a good thing to do, but let's make sure we manage it appropriately within organizations.
Yeah, and two differing opinions have just come through here saying, one, my experience is very different, and I think having an open door policy and speaking honestly, this helps me both as an employee and a line manager. And then somebody else says, but not all staff feel comfortable speaking to line managers for fear of reprisals. So
that's very true. That's very true. Absolutely. And as I said, both are appropriate. Having a mental health first aider is appropriate, and having line managers trained is appropriate. But ultimately, the line manager is the one that can, for example, put reasonable adjustments in place for you, can alter your work, can provide the resources to support you. So that's really where, from my perspective, the training should start.
Yes. I honestly, we've got so many amazing comments coming through here. I wish I could go through them all. I'm conscious of time. I just want to come back though, Naz, if I may, to a question that's come through on the YouTube channel, just kind of bringing the physical bit back a bit. Someone has said, you talked about people feeling unsafe on their commute. Are there any examples of forward-thinking companies who are providing technology for their people when they're feeling unsafe commuting?
Yes, actually, and I can share an example without sort of saying the name of the company, but it's a large media company in the UK, and they had a specific problem. They had shift work going on in their offices, and the car park where the staff parked was through a dimly lit subway where there were a number of incidents and unsocial behaviour, and they had a number of complaints of staff feeling unsafe, having to simply walk to their car. Now, they tried buddy systems and all the rest of it, but what they did is they came and said, look, we think technology is a way to solve this. And we referred to it when I talked about in my presentation earlier, is that there is a smartphone application. But what that application actually does is allow them to raise an alarm to a 24/7 call center or help desk alarm receiving center. And that was the company being proactive and saying, look, here's what we think is a solution. How do you feel about it? Not forcing anyone to take it, by the way, not mandating it, but pushing it out there. And they had a significant take up in that, because it was, everyone uses apps on their phone today, don't they? So they didn't feel it was intrusive in any way either.
Great example. Yeah, thank you for that. And sort of on the, again, linked to cost of living, physical, mental, someone says, I agree with lots of the points being made around the cost of living and the cost of working from home. However, I find it really stressful having to try and weigh up the costs incurred by commuting versus the cost incurred by working from home. Feels like increasingly a no-win situation.
I agree.
Mm-hmm.
It's an impossible question. It's really hard.
Yeah, absolutely. Okay, I'm just going to I think, change tack for the last 5 minutes because I think this question is really interesting, and I go to Heather and Daniel on this. And actually, the physical component, Naz, I think you will be able to contribute to as well. In terms of the generational component to all of this, I think age is becoming a really interesting part of the workplace. We're hearing people coming out of retirement to going back to work. We're hearing young people sort of transforming the workplace because young people are so much more open and know exactly what they want now. So workplaces are like this melting pot of different generations. And I suppose from a mental well-being point of view, Heather, to come to you first, what do you think workplaces, how do they need to step up to deal with, I suppose, these multi-generational aspects of mental well-being?
Gosh, that's such an interesting one, isn't it? It really is. So we're getting increasing calls for training on menopause and managing menopause within organizations. That was a word we didn't use to mention, wasn't it, in public, in polite company? And now we're recognizing, gosh, 50% of the population go through it. Let's talk about it. And also, it's the fastest growing demographic is women over 50 in the workplace. So that's becoming an increasing issue. But, I love TikTok. I know that's not my generation, but there are so many fantastic videos on TikTok that actually show this difference in how generations approach work. And I think that my generation has an awful lot to learn from millennials and Generation Z in the boundaries that they put up to start with. Their self-esteem is far less focused on what they do for a living. So I think it's really interesting. But in general, I think that one of the things that we not only in organizations, but just as a society need to get better at is listening to each other without judgment, you know, because it's really tough sometimes. We hear somebody say something, we hear a Gen Z or you know, or the opposite, we hear a boomer say something, and then we're, oh, you're wrong, you're just wrong, that isn't the way the world works. And yet actually we have to get better at suspending our own values, our judgments, our own paradigms, to be able to see the world in a different way, because we got increasing conflict as well, haven't we? And that just adds to everybody's stress. We don't have a set way of living anymore in the way that we did when my parents were growing up. You did this, then you did that, and you did that, and then you went to heaven when you died. You know, we don't think that way anymore. And so we just need to be a little bit more tolerant and get better at listening. But I'll be really interested to hear what Daniel has to say on this one.
I'm just going to echo what you said. In the workplace, there are two key skills that you can bring to that: kindness and empathy. You're absolutely right. When you say that's not the way it's done, what you mean is that's not the way I did it. That's you. You have every right to say that. That's not the way I did it. Fine, great. That's not the way I want to do it. Fine, great. And we need to teach more kindness and empathy and respect. Think about that war allegedly between boomers and millennials. That's a largely media manufactured, media fueled thing. We used to live in tribes, then we stopped living in tribes. Families used to be generational, then they stopped being generational, they became nuclear. Then they stopped being nuclear, they became broken. And we have forgotten what it meant to be part of a community full of all ages. Well, we spend most of our day at work now, whether it's hybrid, whether it's there or there, most of it's working. So there's your generational community. Everybody has a valid opinion, everybody has a valid viewpoint. You don't have to agree with it, but with kindness and empathy, you can listen and mutually respect one another and learn from one another. I agree, you can learn a lot from people, from the Gen Z. They've got different boundaries, different ways of reflecting their self-esteem. You learn a lot from TikTok, but you also learn a lot from older people. Even if they're a little rigid in their thinking, you can still learn a lot from them, because what they are bringing is experience of life. So it's all about valuing each other, respecting each other, and trying to understand one another, even if you don't agree with each other. And if you can bring that into the workplace, there's a sense of well-being.
Absolutely. Daniel, somebody has just written, "You talk a lot of sense." I thought you'd like to know that. This has been the most interesting discussion. The breadth of the title really has brought in some really varied discussion, and I'm very grateful to you all. Naz, thank you so much for partnering with us on this session. I want to come to you to, a final thought maybe for you about this connection between physical safety and the snippets that we've touched on today on mental well-being, on generations, however you would like to bring this to an end.
Yeah, sure. I think I would just say to please, and Heather and Daniel, thank you. It's been brilliant as well. Zoe, thank you as well for pulling this together. It's just that do not underestimate the impact on well-being or mental health that then an incident, whatever it may be, that happens to you, how it can affect your work environment and your personal life, and that impacts society and the economy in very different ways. And I think we've seen that through this conversation today.
Absolutely. So my grateful thanks to Daniel, Heather, all the team at Peoplesafe, and of course Naz, for joining us today. I can't tell you how many more messages are coming through. I wish we had 2 hours, but I know that everyone needs to go back to work. The recording will be available for you to listen back. Thank you everybody for all your participation and for taking part, asking the questions. I hope you have a great rest of your day, and hope we've sort of given a little bit of inspiration to you for the rest of the day. So thank you everyone for joining us. I'm now going to end today's webinar.
Thank you, Zoe. Thanks all.
Thank you.